Do you want to go ahead and say your name and date of birth for me?
Ellen Mason, 7/31/79.
All right, sounds good. You are in for a head, face, and or nose, mouth, and throat exam and an ears exam. Is that right?
Yes.
All right. Just a few questions about that. Do you have a history of any ear infections or anything?
No.
No. Any history or sore throat? Are you feeling recently or anything?
Nope.
All right. The patient is alert and appears stated age and conversational. Just a few more questions. Check up on some other systems. When's the last time you had bowel movement?
Yesterday.
About how many times a day?
I usually go about once a day.
Once a day. And the last time you peed?
Maybe like an hour before I got here.
Okay. And then about how many times a day?
Probably 7 to 10.
All right. Are you in any pain or anything today?
No.
Generally? No. All right. Sounds good. So, like I said, I'm just going to start out with the ears examination. Is that okay with you?
Yes.
Okay. Sounds good. I'm going to start by just looking at your ears. The ears are equal in size bilaterally. They're proportional to the rest of the head. The skin is intact, and the patient has a lobe piercing in both ears. One lobe piercing in both ears. And then I'm going to look at the ear canal. And I'm going to pull this up and back. There isn't any visible discharge or cerumen. The ear is a light pink in color and is consistent with the rest of the face. I'm gonna feel your ears here. I'm gonna feel the auricle, and then the tragus, and then the mastoid. Is there any tenderness?
No.
I do that, okay. There's no lesions or bumps or masses or any other deformities. And then I'm going to ask you to swing your legs over here. And then I'm going to stand behind you, directly behind you. And if you want to cover your right ear for me, I'm going to say 3 words. If you can just, I'm going to whisper 3 words. If you could just repeat those words back to me, that would be great.
Basketball. Cheerleader. Dog.
All right, and then the other ear.
Laundry. Xbox. Folder.
All right. The patient was able to identify at least 4 out of the 6 words that I said, so she passes the gross whispering test. And you can see the legs back. And then I'm going to go ahead and continue with the nose, mouth, and throat exam. Is that okay with you?
Yes.
All right. I'm going to start by inspecting the outer nose. The nose is symmetrical bilaterally. It's midline. The size is proportional to the rest of the face. No lesions or deformities or masses or bumps. And then I'm going to, if you want to go ahead and plug your right nostril and then sniff in for me. And then do the other. All right, there's no airway obstruction. Both nostrils are patent. And then I'm going to, if you want to tilt your head back. The color of the inner canal is pink. The septum is midline. It's not deviated, and there's no exudate, no blood, no other pus or anything. All right. And then I'm going to feel your face here. The frontal sinus. Any tenderness?
No.
And then this. Any tenderness?
No.
Okay. No tenderness with palpation of the maxillary sinus or the frontal sinus. The maxillary sinus is here. And then I'm going to. I'm gonna look. If you want to go ahead and open your mouth. light pink and smooth and moist, and it moves up with phonation. The tonsils I would grade about a 1+. Let me see again. They move up and in with phonation. The pharyngeal walls are a light pink and smooth, and there's no exudate. You don't have to keep doing that. The buccal mucosa is light pink, smooth, moist. The gums are a pinkish red color, are smooth, and the gum lines are tight. Alright. And then tonsils. Okay. I think that's a little bit of the gums. Okay. And then for the last part of the exam, since we don't have gloves, I'll just verbalize that I would palpate and inspect the lips and tongue for intactness of the skin, for color, and for deformities. And just from inspection here, I can see that the lips are light pink and the tongue is a light pink color. The lips are intact, the skin is intact, there's no splitting, and if you want to stick out your tongue, there's no splitting of the surface of the tongue or anything like that. Do you have any questions for me?
No.
Alright, sounds good. Hand sanitizer. Curtain. I'll be back in a few to check on you.
Thank you.
No problem. I'm so sorry.